South Africa sounded the warning. England warned that it could happen in other countries too. And now the Omicron tsunami is coming here in America and right here in Arkansas. All of a sudden, in just a matter of days, cases have spiked faster than we've ever seen them. On Sunday, 400 cases reported. Today, closer to 4,000. Positivity rates continue soaring and are now trending around 20% for the most recent data. Active cases are spiking too, but the number to really pay attention to is at the top of your screen. 2/3 of our active cases are in people not fully vaccinated. It proves that vaccines are still helping, but not quite as much as they helped during the Delta surge. We're keeping an eye on hospitals, but we don't expect to see what Omicron is really capable of until next month. And right now, it's just a waiting game. Health experts, global and local, are warning that even if Omicron is more likely to be mild, numbers so sky high could still overwhelm our hospitals. THV 11's Ashley Godwin asked how they're preparing.
In the last week, we've doubled COVID admissions here at UAMS.
Omicron has taken over the pandemic here in the Deep South in the span of less than 2 weeks, and hospitals are already feeling the impact.
Just personnel alone, we've doubled the amount of UAMS employees that have been on isolation or quarantine in the last 3 days.
UAMS expects by the first week of 2022, hospitalizations will be even higher. Research is still ongoing on how often Omicron causes severe cases, but with thousands of people testing positive each day and with only 20% of Arkansans boosted, there's no doubt hospitalizations will increase.
If you have 100 times more infected people, even if it's 10 times less infectious, that leads still to basic math showing there's more sick people in the hospital.
We are expecting a very steep increase of thousands of cases in Arkansas, and they will result in an increase in the number of hospitalizations around the state.
CHI St. Vincent sent us a statement saying they have seen an increase for COVID tests and positive results, but few of those new cases have been hospitalized. The hospital system is currently managing the caseload and is monitoring for an additional surge. UAMS no longer has their COVID units open. They are treating COVID patients throughout the hospital. They are still doing well with capacity for patients, but that could change as the number of patients change.
Our numbers are still low enough at the moment where I'm not sure what our plan will be, but as I just mentioned, we've doubled our hospitalizations in the last 7 days, and that will continue to increase.
The Department of Health has a phone number to call if you get a take-home COVID-19 test and are positive. It's 1-800-803-7847. In Little Rock, Ashley Godwin, THV 11 News.
And it's recommended to keep protecting each other and yourself by wearing masks, getting vaccinated or boosted, and taking a test if you have symptoms. We also asked Baptist Health if they're preparing, and we're still waiting to hear back from them.